Good morning, everyone. Ford, that was great. That was a tremendous overview. Of course, I didn't agree with everything. We'll talk about some of that in a minute. I do want to make a comment on one of the questions that Ford asked. When the folks from Darden had choices, they had choices of an HMO, they had choices of a PPO, they had choices of a high-end plan. But really the answer was they chose Florida Blue. And let me tell you, we were not the in-force carrier. Darden went to this private exchange setup. We were then offered for the first time to the Darden population. And we had enrolled 90% of the people at Darden in the state of Florida. So we're all for choice, especially when it works that way. There is a lot going on in the marketplace. And I'm going to try and touch on some things from our perspective, but you just got a great primer on the things that are happening in the market. I'm going to start by just giving a little context around the Affordable Care Act and how that has been rolling out. Obviously, you've heard a lot about premium subsidies, which brings costs down for the individual, but let's be clear, does nothing to change the underlying cost in the system. So in fact, it is a masking agent for what really has to happen in the system. We talked all about the cost-sharing subsidies. There are what we refer to commonly as the 3 Rs, so it's the risk sharing and the reinsurance factors that are in this bill. And then certainly there's some heightened competition. Although in parts of the country, we have to be clear, that's not necessarily the case, and we see that happening in Florida. So we are in all 67 counties. Ford alluded to some of this. We had players like United who decided not to play in the state of Florida. And I want to be clear about our commitment. We're in every county. We are offering dozens of plans on the exchange because this is where we are at home. We don't have the luxury to say this year we're in, next year we're out. We're committed to the state, and I think that's a very critical component of this. But when we look at what else is happening with the Affordable Care Act, we know that we've got a whole new set of market rules, including eliminating pre-existing condition. By the way, the insurance industry is not enamored with having a pre-existing condition exclusion, but when you have a market where people can choose to be in or out, you have to have something that regulates the insurance pool. And so that was the element. The trade on the Affordable Care Act was having everybody in the pool. And I think we're seeing that not everybody's going to end up in this pool. Therefore, that particular element of change not necessarily working very well. One of the other factors, we tend to try and generalize some of the things that happen with the rollout of the Affordable Care Act, one state to another. And I would submit to you that you need to look very closely at what happens in each state. For instance, in the New York marketplace, you have a market that went to community rating, so a singular price in that market. And essentially, they destroyed their individual market. They went from 750,000 people in that market down to something less than 50,000, I believe, by saying everybody should pay the same price. Because what happens? The younger, healthier leave. They're not willing to pay that price. The price in New York today, ahead of the Affordable Care Act, is $1,250 a month. How many young people are joining that pool? Right? So if you put the Affordable Care Act in place in New York with 3 tiers of pricing, you're clearly going to make it more affordable for some people. That's how it affects New York. Well, quickly when that was rolling out in New York, we had the look at what it did to New York. But what you need to think about is also what will it do in Florida, where we have 7 tiers of pricing, lowest price to highest price in the individual market. So think about that. In 7-tier pricing today, I can insure a young, healthy male for about $125, $130 a month monthly premium. That same person in 2014, no condition change, is going to pay about $250, $260 for the same policy. And we're talking about how critical is it for that young, healthy person to be in the pool. That young, healthy person is going to make a decision about whether they're in the pool or not based on how much subsidy they get. If you get a subsidy, that may offset where your premium price went. If it does, maybe you're in. If it doesn't, you now have a much higher hurdle for being in that individual market. And so that's a very, very significant challenge. Essential health benefits, we are improving the benefits, obviously. And so some people maybe want those benefits. Other people, they've made some decisions about whether they wanted to be in that market or not. And we've had a big discussion of late, I'm going to hold that to the end, about cancellations and what does that mean. And we'll talk about that in just a moment. So let me talk about how we see the marketplace, because I think very much like Ford set this up, everybody needs to change, all parts of the market. So let's start with individuals, right? Individuals are now becoming consumers in a much bigger way. It is no longer acceptable for an individual to sit back and say, this is all covered, it's covered in full, because what's happened? The cost is shifting their way. There are higher deductibles. People have chosen to move to higher end deductible plans. And now, when there's more skin in the game, people want information, they want choices, and we're seeing much more of an engaged consumer in the marketplace. Frankly, that's a good thing. That's a good thing for the market dynamics. And that is a change that is only on the front end of happening. We're going to see a lot more in that space. For the health delivery system, frankly, the United States is focused on a sickness care plan. We've been on the back end of the process for way too long. And that's where we compensated care. So I'm not blaming anyone for that. I'm saying it was a payment system that absolutely incented us to work on people once they were ill. We had nothing to incent us as a system to work on the front end of that process. And that's where the shift, the change, the emphasis has to happen. It'll happen through payment models, it'll happen through engagement, it'll happen through education. But that shift is absolutely underway. And then for us, we've called ourselves out as a health solutions company, not just an insurer. Will we do insurance? Absolutely. But our mission is much broader than that. And I'm going to talk to you in detail about how we as a company see our role in this equation and how we're changing and have already changed, but lots more to come to play out that role. First of all, we started right at the core of our company, our mission, our vision, and our values. So think about this as a mission statement for an insurance company to help people and communities achieve better health. That's something we rally around with a passion at our organization. It's not about paying a claim. It's not about issuing a policy. It's helping the community and individuals. That's a very different statement for us. And for our culture, it was a dramatic change. First of all, it's a single sentence, not 4 paragraphs long, and apologies to the attorneys, not drafted by the law department, not drafted by 12 committees. This is something we rally around with focus. We took the 12 words we had up there for values and shrunk them down to 5. In my view, a management style thing for me is it's got to be 5 or fewer if you want people to execute against it. They have to be able to know it. They have to be able to focus on it. And so we moved our number of things we listed as our values down to 5, and we had 2 things that weren't on the previous list. And those 2 things I like to call out repeatedly: courage and imagination. Now go ahead and admit it, imagination is the first word you thought about when you thought of an insurance company, right? I know. But I'm here to show you a few things about what we're doing that hopefully will restructure what you think about our company and how we've positioned ourselves in the marketplace. And imagination and innovation are very critical parts of that. First of all, just at a structure level, Those of you in Florida know that we've restructured our company. At the top of our company now is a holding company called GuideWell. And that is the holding company for our entire organization, a piece of which is Florida Blue, the insurance company. But also the GuideWell Group will be our consumer business. Our business is focused on how do we connect on a retail level across the state. Now this isn't, we're just starting these activities. We've been doing these things. We're calling it out now, and we're structuring around this. So as we went through this process this last year, we went through a process where we had a public hearing, we filed with the OIR, we had a vote of our membership because we're a mutual insurance company. 93% of our members voted to support this structure change and voted to approve the fact that we have now moved our revenues so that we've got our revenues split over these two entities so that we will be serious about our investment and our commitment to the retail side of the health equation. Some of you know that we changed our name to Florida Blue. Now it's less than 2 years ago, but we are very much Florida Blue, and it is not just cosmetic, because you're seeing all of the change that comes underneath having that name up there. So the move is from the health insurance company to a health solutions company. So what does that mean? It means a lot of different things, but let me tell you, in the delivery system space, you look at the state of Florida here, we started by being out there doing bundled payment arrangements, and some of those are good and appropriate for certain services. We then put patient-centered medical homes together all across the state. We now have over 2,300 physicians operating in patient-centered medical homes. What does that mean? We're paying more at the primary care level to keep the offices open longer, to avoid emergency room visits, to have quality incentives built into the payment arrangements for primary care. And as we're paying primary cares in our patient-centered medical homes more dollars, we're experiencing 6% less total cost of health care if a patient sees one of our patient-centered medical home primary care physicians as opposed to being outside of that network. We've established Medicare collaborative care models, so focused groups working on Medicare. Very specific set of issues that the senior population is dealing with, and so we've put very focused groups on that issue. We own 2 staff models, one in Daytona and one in Tallahassee. And these we've had for a number of years, but now we're working more aggressively to integrate the learnings from those staff models into everything else that we do. We bought Physician Group down in the Daytona area, the diagnostic clinic. This was a medical group that came to us and said, we don't want to be owned by the hospital. We want to be in a different arrangement, and so we got involved in a dialogue with them because it was right in that marketplace. We don't necessarily believe that this is the right answer in all marketplaces, but this medical group very specifically did not want to be owned by a hospital. And it's a high quality group, and we thought this would be an important relationship for us to have. We've created accountable care organizations all over the state. Now, I arrived here from Minnesota, and the first thing I heard is, this is Florida, it's not Minnesota, and nobody will sign up in an ACO. I see Bill Rupp smiling at me because he knows Minnesota. But what we found is that we're at a tipping point in the market. The market is moving very differently. And while it may not have been open arms embrace, we have found the ability to put 8 accountable care organizations in place, and we've got lots of other discussions going on. So as you see this map fill out, you're seeing a very different mosaic for what the state of Florida looks like. You're also seeing that we're not going to each market and saying, this is the only answer here. We're partnering and collaborating in each one of those markets. We're sitting down with the folks that are running the health systems, running the medical groups, running alternative delivery systems, and cobbling together what we think is the right answer in each one of these geographies. And so the answers vary. And I think one of the very important things we lose when we try and do healthcare from Washington, D.C. or someplace else is you lose that local nature. And while there are important national lessons, healthcare is delivered in our community all across the country. And so you need to understand the dynamics. You need to understand the ethnicity, the patterns of purchase. You need to understand what's on the ground. You need to understand what that community needs. And so it's really important to have a very tight local focus on how you set up your systems. We have also ventured into the retail space. We started this in 2006. We now have 17 centers around the state of Florida. These centers engage people with a real bias towards health, wellness, and prevention. And we did this in anticipation that the marketplace was going to become more retail. And I can tell you, when I arrived 2 years ago, we had 4 of these centers. So we put this in hyperdrive to have 17 of them out there now, because we doubled down on the retail center concept. If you've not been in our retail centers, you ought to check it out. In our retail center, there's a variety of services that you can receive. These services run all the way from, you can come in and shop across any of our individual products, but you can also come in and have a claim resolved face-to-face. So think about what some of the complaints you've had about insurance companies. It's distant, I'm on the phone, I can't connect. We'll resolve that face-to-face. We'll take care of that issue. You know, one of the things we looked at is the Massachusetts Exchange. And one of the things we found out about the Massachusetts Exchange is nobody finalizes on the exchange first time they contact. They go, they shop, they look at their choices, and then they want to talk to somebody. Then they want to understand those choices. And we're giving our customers an opportunity to understand what we bring to them in a face-to-face setup. Now, we obviously have a lot of seniors in our marketplace, so having retail centers makes a lot of sense for our market. We also do everything we do in our retail center online. So you can get all of the services that we provide in this center online, but we want to make sure we're in every one of those activities, because frankly, someone came to me when we opened our retail center in Tallahassee, and it was a reporter and wanted to have a story angle and said, what the heck are you doing with putting bricks and mortar out there when everybody is going to online? And my answer back was, why does Apple have a retail store? Think about that. Apple can do everything they do online. And what's the difference in healthcare? More personal, more expensive, more complicated for sure, and we want to be there for our customers. And if we're going to emphasize the front end of the process, you got to do that. But one of the things we learned a big lesson on is engagement. So it's very different to say we're in a retail center. Frankly, I have competitors that say all the time, oh, I got a retail center. They have a small shop with one person sitting in there who does sales. You can see this model's very different. You can get the full range of services in here. And we do things like we run a 5K run that starts and ends at the center. We are big into childhood literacy all across the state. So we give books away to kids. We bring them to the centers. We combine the sports teams that we have relationships with, and we have those players read to the kids. It exposes their teachers, the children, their parents, to an environment where we're emphasizing early childhood education. To while they're there having fun, learning about reading, they also get education about portion size, exercise, hydration. We're pumping all of these lessons through our retail centers. And we're looking for lots of ways to continue that revolution in our state. Because again, take it back to our mission. We're there to help people and communities achieve better health. And this is critical to where we're trying to go. So these retail centers have been built in a way that is really inclusive. You know, when we had this center opened in Tallahassee, had the gentleman who is the advocate for the disability community come up to me, didn't realize he was there. He rolls up to me in his wheelchair and he says, you know what, when you built this center, you were really thinking about me. Because I could come to the front door, the door opened, I could roll up to the counter, you had some of your counter space at my height, I could access everything in this center from my wheelchair. And one thing that a lot of people don't realize about the state of Florida, 12% of our citizens are people with disabilities. Now multiply that out to people who are taking care of people with disabilities. It's a huge part of our population. Think about wounded warriors coming back to our state. Significant part of our population. So we've tried to think really inclusively about how we build these centers and how we play in that retail space in a very serious way. So again, we are all over the state. Another thing we've been very careful about is we reflect the community we're serving in. So when you go to our center in Miami, everyone's bilingual, right? And so we have been very sensitive to what are the demographics around each one of these centers. We've been very thoughtful about how our retail connection really connects us to everyone that we serve. So now you've got this retail center. We're starting to demo various products in the health space, because if you're about health, you got to help people get to these places, right? And so if you're a member of ours, you get a discount on anything you can access through Health Shop, whether it's in our center or online. So we're making the health and health-related equipment, pedometers, vitamins, all kinds of exercise equipment available to our members. So think about it this way. We have retooled our company to be very much a health solutions company. Insurance is something we do, but it's far from all that we do. So I want to talk a little bit about innovations, right? So everything that we do, I touched on the fact that everything that we do, you can do in our centers. But we've also reached out to employers. Many employers are now having worksite wellness clinics. We're very much involved in that part of the world. Our wellness and prevention program called Better You from Blue is a very popular program because we have to get on the front end of this obesity epidemic in our country. Expense is going to eclipse anything we've ever thought about if we aren't on the front end of this process. And so we're deeply invested in this end of the equation. Let me talk about a couple of our critical partnerships in the innovation space. Many of you are aware of what's going on at Lake Nona. We just opened this past month at Lake Nona the Florida Blue Imagination Center with partners Cisco, GE, and Johnson & Johnson Wellness and Prevention, kind of partners that we want to play with. We're looking at how do we change the face of healthcare in Lake Nona, in Florida, in the country. Because we think we can make huge difference in thinking about how we build a community there built around health and wellness from the start. This is a greenfield community just a few years ago, and our partnership there is going to be a critical laboratory for what works in healthcare to learn many, many lessons for the rest of our state. Here in Jacksonville, we brought to Jacksonville an organization called Health Box. We now have 7 entrepreneurs working in a common workspace that are pushing the envelope. These are the folks we're talking about, the innovators, the people who are absolute entrepreneurs, but we seeded them. We invested in them. We brought them together so that they ping off of each other, because oftentimes entrepreneurs in that setting can actually accelerate their advancement. And they're right here in downtown Jacksonville working in a space. And we intend to invest in them, and then when they come up with the ideas, and many of these ideas are starting to take real roots, when they come up with great ideas, we expect to deploy them across Florida and then help deploy them across the Blue Cross system across the country. So lots of exciting things happening in that space. We've also been involved in the MetaFuture activities, visioning the future of healthcare in the Tampa Bay marketplace. So all over the state of Florida, we're playing in the innovation space in a very, very big way. Now, this may look like fun. I hope it does. One of the really critical messages in healthcare is that you can't just lecture to people. You can't just give them numbers. You got to make it fun, right? So recently I had the opportunity to chair the American Heart Walk here in Jacksonville, and we had Iron Man because we have a partnership with Marvel at the event. You watch the kids go to Iron Man. It was off the chart. We then brought Iron Man to our retail center in Town Center. We expected to have 300 people come see him in the 3 hours that he would be available. We had almost 800 people show up. just from putting a few flyers out in schools and places. Now, while these kids were there, what did they do? They shot baskets, they threw footballs, they did hula hoops, they got a lecture on portion size, they got discussion about hydration, and we got them on the path of understanding their health. And it's an activity that we continue to work at. On the right-hand side of that slide, you see Habit Heroes. This is our partnership at Walt Disney World. You go to Epcot, you will see the Florida Blue Habit Heroes exhibit in Epcot, teaching children about hydration, nutrition, and exercise. The Disney folks who know the numbers inside and out tell us 500,000 Floridians will walk through that site annually. So we are continuing to bring that message. The message they learn at the site, while they're having a lot of fun, you sneak in the education. And this becomes a game that they then can play on their smartphones, they can play on their computers at home. The game continues to change, but continually teaching lessons about health and wellness. So we are infiltrating the minds of our youth to try and get them on this path from early on. We know you have to meet people where they are. I don't know about you, but I know that if I'm trying to talk to any one of my college-age kids, that I need to text them to tell them I want to make a phone call, right? It's just, you got to meet people where they are. And so this is a very, very critical part of engagement. We must think about engagement when we're trying to deliver anything. One of our critical partnerships, and Eric Mann is here, is that as we have the new Y going up in Jacksonville, that we're putting our next retail center inside that Y. And so that's another critical partnership for us, and I know the folks from Brooks will be in that center as well. So think about having a Y, having a rehab center, having the Florida Blue Retail Center coming together. That's a very different collaboration. That's not an insurance company activity. That's a health solutions company activity. So we're excited about the start of that. When we look at our foundation, we think about how do we leverage our foundation and change the community that we live in. So we could have gone to Feeding Tampa Bay and said, here's X dollars, or here's the next shipment of food. But what we did is we sat down and had a strategic planning meeting with them. And what they told us is they can't serve fresh because they didn't have the refrigeration to do it. So what we did is change their refrigeration. And so now if you go to Feeding Tampa Bay, you don't get the big clunky stuff. There's some of that there, but there's a whole lot more fresh there. And there are a lot of people in our communities across the state who are eating out of these food pantries. And so our intention is to systematically change what's happening in these food centers across the state to get things right in the first place. We're building community gardens all across the state in partnership with community groups, in partnerships with schools. You'd be surprised how many inner city kids know nothing about a fresh vegetable, maybe haven't even seen one, right? And so we're doing partnerships all across the state to really get our kids on the right path. Now, some of this is obviously long-term payoff, but we must change the way we think about our health, our well-being, and how we engage it from the earliest stage. We've heard about the shortage of primary cares. Well, we have just celebrated, Florida Blue has just celebrated our 2,700th nursing scholarship, because there's a lot of nurses who will be delivering primary care in our state. And so we committed to this a number of years ago, and we continue to be committed to nursing scholarships all across the state. Each one of these programs is transformative and really thinks about the big picture. So I wanted you to understand who we were before I talk to you about policy issues, because who we are and where we're going is very different than maybe a number of you thought about an insurance company walking in the door. So let's now talk about some of the hot issues. Cancellations versus transitions. There's a certain set of facts you need to know. We, Florida Blue, got a lot of press because the number was being thrown around, 300,000 cancellations. What Florida Blue did was this: we complied with the law. End of statement. Now, when we sent the letter out, We did what I believe is the right thing, and I've reviewed that letter, frankly, in the White House, line by line. That letter says, because of the Affordable Care Act, your plan no longer meets the test of the essential health benefits. Therefore, your plan will no longer be available past the end of the year. But here's an option that we're making available to you through the exchange. This one maps closest to the plan that you have currently. And if you don't like this plan, here are alternatives. If any of this is confusing, here are 4 different ways you can reach us: via phone, online, our retail centers all across the state. We gave people lots of ways to reach to us so that we transitioned them. The word cancellation to me means, I'm done with you, I'm walking away, which is why I took exception to it. You heard the reference to Meet the Press. I went on Meet the Press to set the record straight that we were not canceling people and walking away. We were helping them navigate through a change we needed to comply with and that we were trying to help address. The question comes up, would you continue people in those plans? Absolutely. We would continue people in those plans if we had the ability to do that. And I can tell you that there's heavy discussions going on in Washington, D.C., and discussions going on in Tallahassee around just that. Will you extend people? Now, will it be confusing? Oh my gosh. If I were one of these members, I'd be saying, somebody's got to get their act together, right? Because you just told me I'm canceled, and you just helped me move to a new plan, and now you're telling me I could move back to the old one. It's going to be confusing, folks, right? But is it the right thing to do? Yeah, I think it will be the right thing to do. Will we lose money doing it? Absolutely. This is not a good thing for us, but it's the right public policy. So I stand before you today to say that if those in power make decisions that allow us to continue people, we will support that, and we will do what we have to do because it's the right thing for the people we serve, and that's where we want to be on this issue. Marketplace impacts. I gave you some of the sense about what's happening in terms of the rating and the rating formula. When you try and compress those 7 rating categories down to 3, you are driving the price of young folks up significantly. That will have some very negative effects. So we are concerned. We have tried to be supportive of the law. It's the law. We think the law needs some changes. We have been very clear that when we're trying to achieve an Affordable Care Act, we shouldn't be raising taxes. Taxes at the federal level, taxes at the state level on an insurer end up costing the consumer. So if you see a bill that says your taxes are going up or the tax on the insurer is going up at the federal level, for that matter, device manufacturer tax, does anyone in this room think the device manufacturers are ultimately paying that tax? That tax will end up in the consumer's pocket. The tax on insurers will end up in the consumer's pocket. If we do that at the state level, that will end up in the consumer's pocket. We need to be honest about what we're doing when we raise taxes, right? And so we've been very clear about this from the start, that that's one of the things we thought was counterproductive. The quick civics lessons on this is that we were attempting at that time, and it's almost funny to think about it now, we were attempting at that time to keep the price of this law under $1 trillion, and so we started thinking about what were the revenue offsets that could help what was going to cost more than $1 trillion to come under $1 trillion. We're well beyond $1 trillion as it's been rescored, but that was the initial driver. And the other piece that, many Democrats in Washington would tell me is we were going to take that out when we went to conference committee. But the civics lesson on that one is, if you remember the election of Scott Brown, that meant that Democrats no longer had 60 votes in the Senate, and therefore there was no conference committee. We have the Senate bill jammed through the House, signed by the president. That's essentially what we got. So there's many Democrats who wanted to change the law, and there's certainly a host of Republicans who wouldn't have had the law in the first place. But that's where we sit, with lots of dislocation as a result. I'm going to touch on this last topic in just a moment. I want to say, sort of one other thing. We continue to believe that covering as many Americans as we possibly can is a good thing. The system needs to have everyone in it, everyone who can possibly be in it, for it to work logically. Think about what happens today. We get all kinds of people in our hospitals, uncompensated care, and that uncompensated care ends up in everybody else's bill. It's not logical. And the folks who decide to not be insured, those same folks absolutely expect to be treated when they show up at the hospital, even though they don't have insurance. So we've got that issue that really is a core public policy issue that we still haven't dealt with. And that is the challenge for all of us. On the Medicaid expansion front, I would say to you this. I believe that we need to look at expansion. It doesn't necessarily need to be Medicaid as it's been described in the federal law. I think we have the opportunity to alter that plan in Florida and do something that we think makes sense. And I think there are a lot of stakeholders in that discussion. But what we should not do is leave, the $50 billion of federal funding on the sideline. That's money that can be well applied in Florida. What we have today, where we cost shift to business because business is paying the bill, will get exacerbated by not taking the Medicaid expansion funds. We need to take those funds. I challenge us to, how do we take the funds and not just push them through the system as it exists today? How do we take the funds and dramatically transform the system we have today? At the root of our problem is a fee-for-service system that pays the more you do, the more you get. We must change that system to pay for value. And I think we can take the funds from Washington, D.C., and establish in Florida goals and clear criteria for moving the system from fee-for-service off fee-for-service. The first 3 years are 100% funded by the federal government. It slopes down from there to a 90% funding. At the end of 10 years, if we don't have our whole health system off of fee-for-service, shame on us. So establishing goals for getting us off of fee-for-service over those 10 years is what we ought to be focused on. We can talk all about different plan designs and how to shift things and how to mask costs. If we take our system in Florida and move us to a value-based payment system where the incentive is to do well and to do it right the first time, we can have the collaborations we need in the marketplace. We can take that fund and apply it so the system transitions. Because if we jolt the system by bleeding it, if you will, of that funding, which I know every one of the hospital executives planned on, we will create unintended consequences in the marketplace. We will end up with more volume, not less. And so I think there's a way to apply those funds to get the result we're all looking for. And that's why we as a policy position have been in support of expansion, but expansion with a lot of clear caveats around how the funding plays out and where the incentives are in the marketplace. And with that, I will conclude, and I know I'm back up here for the Q&A with the panel in just a few moments. Thank you.